Ginseng has been used in traditional Chinese medicine for centuries. The slow-growing, short plant with fleshy roots can be classified 3 ways depending on how long it's grown. It's fresh, white or red. The fresh ginseng is harvested before 4 years, while the white ginseng is harvested between 4 to 6 years, and the red ginseng is harvested after 6 or more years. There's many types of the herb, but the most popular are American ginseng and Asian ginseng. American and Asian ginseng vary in their concentration of the active compounds and the effects on the body. It's believed that American ginseng works as a relaxing agent, whereas the Asian variety has an invigorating effect. Ginseng contains 2 significant compounds, ginsenosides and gintanin. These compounds complement one another to provide the health benefits. Ginseng has beneficial antioxidant and anti-inflammatory properties. Some test tube studies show that the ginseng extract and the ginsenoside compounds could inhibit inflammation and can increase antioxidant capacity in the cells. For example, one test tube study found that Korean red ginseng extract reduced inflammation and it improved antioxidant activity in skin cells from people with eczema. The results are promising in humans also. One study investigated the effects of having 18 young male athletes take 2 grams of Korean red ginseng extract 3 times per day for 7 days. The men had levels of certain inflammatory markers tested after performing an exercise test. These levels were significantly lower than in the placebo group, lasting up to 72 hours after the testing. Lastly, a larger study followed 71 post-menopausal women who took 3 grams of red ginseng or placebo daily for 12 weeks. Antioxidant activity and oxidative stress markers were then measured. Researchers concluded that the red ginseng may help to reduce the oxidative stress by increasing antioxidant enzyme activity. Ginseng could help to improve brain functions like memory, behavior, and mood. Some test tube and animal studies show that the components in the ginseng, like ginsenosides and compound K, could protect the brain against damage caused by free radicals. One study followed 30 healthy people who consumed 200 milligrams of Panax ginseng daily for 4 weeks. At the end of the study, they showed improvements in mental health, social functioning, and mood. However, these benefits stopped being significant after 8 weeks, suggesting that ginseng's effects might decrease with extended use. Another study examining how single doses of either 200 or 400 milligrams of Panax ginseng affect mental performance, mental fatigue, and blood sugar levels in 30 healthy adults before and after a 10-minute mental test. The 200 milligram dose, as opposed to the 400 milligram dose, was more effective at improving performance and fatigue during the test. It's possible that ginseng assisted the uptake of blood sugar by the cells, and this could have enhanced the performance and reduced the mental fatigue. But it's not clear why the lower dose was more effective than the higher one. A third study found that taking 400 milligrams of Panax ginseng daily for 8 days improved calmness and math skills. And what's more, other studies have found positive effects on brain function and behavior in people with Alzheimer's disease. Research has shown that ginseng may be a useful alternative for the treatment of erectile dysfunction in men. It seems that the compounds in it can protect against oxidative stress in blood vessels and tissues in the penis and can help to restore normal function. Additional studies have shown that ginseng may promote the production of nitric oxide, a compound that improves muscle relaxation in the penis and increases blood circulation. One study found that men treated with Korean red ginseng had a 60% improvement in erectile dysfunction symptoms compared to a 30% improvement produced by medication used to treat erectile dysfunction. Moreover, another study showed that 86 men with erectile dysfunction had significant improvements in erectile function and overall satisfaction after taking 1,000 milligrams of aged ginseng extract for 8 weeks. Ginseng may strengthen the immune system. Some studies exploring its effects on the immune system have focused on cancer patients undergoing surgery or chemotherapy. One study found 39 people who were recovering from surgery for stomach cancer, treating them with 5,400 milligrams of ginseng daily for 2 years. Interestingly, these people had significant improvements in immune function and a lower recurrence of their symptoms. Another study examined the effects of red ginseng extract on immune system markers in people with advanced stomach cancer who were undergoing post-surgery chemotherapy. After 3 months, those taking the red ginseng extract had better immune system markers than those in the control or the placebo group. Furthermore, a study suggests that people who take the ginseng could have up to a 35% higher chance of living disease-free for 5 years after curative surgery, and up to a 38% higher survival rate compared to those not taking it. It seems that ginseng extract could enhance the effectiveness of vaccinations against diseases like influenza also. Ginseng may be helpful in reducing the risk of certain cancers. Ginsenosides in the herb have been shown to help to reduce inflammation and to provide antioxidant protection. The cell cycle is the process by which the cells normally grow and divide. Ginsenoside could benefit this cycle by preventing abnormal cell production and growth. A review of several studies concluded that people who take the ginseng may have a 16% lower risk of developing cancer. Moreover, an observational study suggested that people taking ginseng could be less likely to develop certain types of cancer, such as lip, mouth, esophagus, stomach, colon, liver, and lung cancer, than those who don't take it. Ginseng may also help to improve the health of patients undergoing chemotherapy, reduce the side effects, and enhance the effects of some treatment drugs. Ginseng has been shown to help to fight fatigue and to promote energy. Various animal studies have linked some of the components in ginseng, like the polysaccharides and the oligopeptides, with lower oxidative stress and higher energy production in the cells, and this could help to fight fatigue. One 4-week study explored the effects of giving 1 to 2 grams of Panax ginseng or placebo to 90 people with chronic fatigue. Those who were given the Panax ginseng experienced less physical and mental fatigue, as well as reductions in oxidative stress than those who were taking the placebo. Another study gave 364 cancer survivors experiencing fatigue 2,000 milligrams of American ginseng or placebo. After 8 weeks, those in the ginseng group had significantly lower fatigue levels than those in the placebo group. Furthermore, a review of over 155 studies suggest that the ginseng supplements may not only help to reduce the fatigue, but also enhance the physical activity. Ginseng seems to be beneficial in the control of blood glucose in people both with and without diabetes. American and Asian ginseng have been shown to improve pancreatic cell function, to boost insulin production, and to enhance the uptake of blood sugar in the tissue. Moreover, studies show that ginseng extracts help by providing antioxidant protection that reduces free radicals in the cells of those with diabetes. One study assessed the effects of 6 grams of Korean red ginseng along with the usual anti-diabetic medication or a diet in 19 people with type 2 diabetes. Interestingly, they were able to maintain good blood sugar control throughout the 12-week study. They also had an 11% decrease in blood sugar levels, a 38% decrease in fasting insulin, and a 33% increase in insulin sensitivity. Another study showed that American ginseng helped to improve blood sugar levels in 10 healthy people after they performed a sugar drink test. It seems that fermented red ginseng could be even more effective at blood sugar control. Fermented ginseng is produced with the help of live bacteria that transform the ginsenosides into more easily absorbed and a potent form. In fact, a study demonstrated that taking 2.7 grams of fermented red ginseng daily was effective at lowering blood sugar and increasing insulin levels after a test meal compared to a placebo. How much ginseng you take depends on the condition that you want to improve. Overall, daily doses of 1 to 2 grams of raw ginseng root or 200 to 400 milligrams of extract are suggested. It's best to start with the lower dose and increase it over time. Look for a standard ginseng extract that contains 2 to 3% total ginsenosides and consume it before meals to increase absorption and to get the full benefits. For more information about herbs, supplements, and natural treatments, check out my website.